going to be talking about hypertrophic cardiomyopathy. I had to read it for a second. But before I start, I just want to say I'm not a doctor. I'm in no way a medical professional. It's just kind of a hobby. You know, I have to start with makeup somewhere. Start somewhere, right? I'm also not a professional at doing makeup either, so bear with me. It's gonna look terrible either way. It's gonna move this a little bit. Yep, moving it didn't do anything. Moving it did exactly what I thought it would do. Nothing. Nope, stop falling. Stop. I need a mirror. I need to buy a mirror. Is this YouTubing or is this like medical? Who knows?
YouTubing.
Is it YouTubing?
It's YouTubing.
It's Mewtubing? That just sounds like a Pokemon. I don't think that's what I'm doing. Dig through this assortment of brushes. That's not what I need. Oh my god, why'd I get so many? Oh, no, wait. Yes. No. Yes. Hypertrophic cardiomyopathy is a genetic condition. Meaning if no one else in your family has it, you're totally safe. I mean, I shouldn't say totally because you might just not know if they have it. So hypertrophic cardiomyopathy is a disease in which the heart muscle becomes abnormally thick. Hypertrophied. Hypertrophied? I think that's how you say it. I can't find 90% of my makeup right now. Can I have my eyebrow pencil, please? Thank you. Oh, HCM is a disease in which the heart muscle becomes abnormally thick, making it harder to pump blood. I'm just gonna try and navigate here. This is really hard. Hypertrophic HCM often goes undiagnosed because many people with the disease have very few, if any, symptoms whatsoever. So like you're all asymptomatic over here. Oh, I'm living my life. Next thing you know, and oh my god, what just happened to her? I'm just gonna. How do people multitask? I just don't understand. They're all like, oh, I'm gonna talk about this movie or about this person and do my makeup. And I'm like, haha, no. No. Oh, you get one of those things. You get one at a time. Is there a medical condition for not being able to fucking multitask? There's probably. The hardened heart muscle, it can make it hard to breathe. I feel like essentially you end up with like symptoms of like angina from it, like the chest pain, the shortness of breath, you know what I'm saying? Like, all that not good stuff that comes with unfortunate genetic heart problems. So some of the symptoms of HCM are, so chest pain, this especially will happen during exercise because again, your heart can't like pump blood well, and you know, when you exercise, it like needs to pump blood. So, you know, those two things hand in make sense. Fainting is a big one. Now, mind you, just because you faint doesn't mean you have this. So don't say Kayla told you that you have it, because I didn't. Especially during or after exercise, apparently, or exertion. Could cause a heart murmur, which a doctor might detect listening to your heart. So heart murmurs are actually the sound of like a whooshing. It's like a whooshing or a swishing sound. Just blood in or near your heart. Your doctor can hear those. Normal heartbeat makes two sounds. Lubbed up. Yeah, that says that. Sometimes described as lubbed up. So exactly what I just read to you. When your heart valves are closing. Isn't blood in your heart normal? Thing to take from this, a heart murmur is bad. Another symptom you could get with this is the sensation of rapid fluttering, you know, pounding, pulse, heartbeats, whatever you want to call it. Heart palpitations. Anxiety can cause them, and really anything can cause heart palpitations. You know, you stood up too fast. Thanksgiving dinner, that kind of jazz. Oh boy, I need to work on my makeup skills and my talking skills. That might be too much. That's okay. And like I mentioned earlier, shortness of breath, especially during exercises. So obviously, like, call 911 if you have like symptoms like chest pain, shortness of breath, rapid heartbeat, abnormal heartbeat. I have to re-say that because my camera stopped me. This maximum recording time has been reached. So anyways, atrial fibrillation. I hate saying this word even more than the hypertrophic cardiomyopathy. So essentially what it's doing is it's bouncing the blood around in your heart, and just kind of thickening it, like kind of like how you make butter. Just disgusting, but that's kind of what it's doing. They beat chaotically. It was described to me as shaking, though. Chaotic makes more sense, and then it forms a blood clot. And like blood clots, obviously, anywhere in your body, they're dangerous. Blocked blood flow. This is just obvious. So like with the blocked blood flow, obviously, like, you know, there's a blockage in your heart that's going to lead to, well, a heart attack. So essentially, when you have like a blockage, the blood can't get into your heart, and so your heart muscle starts dying. Is a it's a heart attack. That's a heart attack. If the thickened heart muscle like blocks the flow of blood leaving the heart and block the blood flow between the left atrium and the left ventricle, so the mitral valve. So like, hey, let's empty blood into this chamber valve. You know what I'm saying? So it might not close properly because of the thickened muscle. So it can't, you know, the result, you could end up with like blood leaking backwards back into the atrium. So mitral valve regurgitation. So this could lead to like worsening symptoms, I'd imagine, especially because it definitely says that online. This could lead to another complication known as dilated cardiomyopathy. So in a very small number of people with hypertrophic cardiomyopathy, the thickened heart muscle may become weak and ineffective. The ventricle becomes enlarged or dilated. So, ladies, you know what dilated means. Its pumping ability becomes much less forceful. So, essentially, because it's so dilated, it's like it's used to having a whoosh, like because that's the best way to describe it, like something pushing it, right? But like now, nothing's. It's not really pushing it as hard. It's like having a lazy day. It's like, okay, fuck you. I'm not gonna help. So do your own thing. So the other thing it can lead to is heart failure. The reason it leads to heart failure is because the thickened muscle or whatever, the thickened wall muscle, whatever, the thicken. I just keep saying thicken now. So this could eventually lead to heart failure. The thickened heart muscle can eventually become too stiff to effectively fill your heart with blood. So your heart won't be able to pump enough blood effectively to meet your body's needs. And our bodies have needs. And unfortunately, in, you know, severe cases, it can lead to sudden cardiac death. And unfortunately, because a lot of people don't actually know that they have this, a lot of your symptoms, like, oh, well, maybe I'm asthmatic. That's why my chest hurts, and, you know, yada, yada, yada. So you might not even realize you have a problem. And that this is why like sudden cardiac arrest is an outcome for some of the people with the condition, is because they don't know they have it. Another thing about this that I'd actually like to raise awareness of, because I myself having heart problems at a young age, this has no age boundary. This is something you were born with, could have diagnosed in your 20s. So if you think you have this, or if you know someone in your family had it and you have similar symptoms, and your doctor's just not listening to you, this happens at all ages. This is not, oh, I'm in my 40s and now this is happening. This can happen 18. This can happen at 2. So if you think something's wrong, really, really push. The way this is actually diagnosed is mostly, by the looks of it, through listening and imaging. So for imaging, like they'll probably send you first off, right off the cuff, for a echocardiogram. So it's an ultrasound for your heart. So they just take a probe, they take some of that cold ass jelly. So they're going to do an echocardiogram. They're not the most comfortable tests. I'm going to be honest with you. They're really not. But it uses sound waves to look around your heart's chambers and just like make sure everything's okie dokie and that you a-okay. The next test that they would do to diagnose this would be an electrocardiogram, so an EKG or an ECG. So they put a bunch of nodes on you, like these little stickers, and then they will put like these wire thingies and hook it up to a machine where they can read your ECG or EKG. The way that they could not necessarily diagnose it through this one, this one's more of like a symptom. They would be finding a physical symptom. So what it would look for would be probably the murmur or the arrhythmia, more likely an arrhythmia, I'm not gonna lie, on a ECG, EKG, I don't know. Whenever I go to the hospital, it's always something different. That or a cardiac MRI. And in my experience, with having MRIs, they're not the worst thing in the world. They're not particularly fun because you're in there for like 2 hours just kind of staring at the ceiling going, hey guys, what's up? I have no idea. Yeah, I'm using a blending brush to rub it in. Stop. Anyways, you're just kind of like, hey guys, like I'm just kind of here. Like, and they talk to you once in a while, but I'm pretty sure they shut the microphone off right away so they can't hear you. So that didn't make you nervous. Well, right. Get into my skin, would you? Apparently something else that they use, it would be the Holter monitor. Holter monitors you wear for like 2 days. Sometimes they'll do 7 days. Sometimes they'll do 2 weeks. It all depends on what your specific case would call for. So like a Holter it's the same idea as an EKG or an ECG. It's just it's just one that you wear all the time and prevents you from bathing and makes you disgusting. So that's awesome. Treatment for hypertrophic cardiomyopathy would be to relieve the symptoms and prevent any sudden cardiac anomalies. So heart attack, whatever, what have you. If you were gonna go into atrial fibrillation and like let's say you're like go and form them blood clots, like, so they'd probably put you on like blood thinners just to be safe, or actually, yeah, they'd put you on blood. I'm reading it right now. They'd put you on blood thinners just to be safe, just in case you do decide to like form a blood clot. And even so, if you're on blood thinners, it's really gonna help with the stiffness on that wall because it's hard for it to pump blood right now anyways. So like it would just kind of make it a little bit better, you know what I mean? One of the treatments is also calcium channel blockers, such as verapamil, or I'm not saying any of these words. Calcium channel blockers. That's what you get. Look those up. They will also put you on beta blockers and heart rhythm drugs. So like heart rhythm drugs, well, obviously it's kind of self-explanatory. Beta blockers are essentially going to make your heart not bleed. Jesus. Beta blockers are used to control your heart's rhythm, treat angina, and reduce high blood pressure. So that's good. That's great. Okay, so other treatments would be like surgery and stuff, right? So, okay, so what you would essentially be going for surgery, it's called a septal myectomy. The surgery may be done using different approaches, depending on the location of the thickened heart muscle. In one type, called apical myectomy, surgeons remove thickened heart muscle near the tip of the heart. Sometimes the mitral valve is repaired at the same time. Septal ablation. This procedure destroys the thickened heart muscle with alcohol. Ooh, I could get behind that. So this procedure destroys the thickened heart muscle with alcohol. The alcohol is injected through a long, thin tube, a catheter, into the artery supplying blood to that area. So part of the complication for that would be disruption of the heart's electrical system, causing a heart block, which requires implantation of the implantation of a pacemaker. Implantable cardioverter defibrillator, ICD. An ICD is a small device that continuously monitors your heartbeat. It's implanted in your chest like a pacemaker. If a life-threatening arrhythmia occurs, the ICD delivers precisely calibrated electrical shocks. That sounds great. To restore a normal heart rhythm. It has been shown to prevent sudden cardiac death, which occurs in a small number of people with hypertrophic cardiomyopathy. Some things you can do at home to kind of like help with this condition or prevent it from worsening would be using caution when playing sports. So like don't overexert yourself. Same goes for like exercising of any kind. Just don't overdo it. Don't hurt yourself trying to I don't know sports. Trying to play hockey. Eat a healthy diet. Maintaining a healthy weight. Reducing alcohol use. Taking your medications. Okay, this has got to be a joke. Having regular medical appointments. So talk to your doctor all the time. You should also try to reduce your stress. You should get a lot of support and follow the lifestyle changes your doctor recommends. So that's hypertrophic cardiomyopathy. It doesn't sound fun to live with. I wouldn't want to. Unfortunately, I mean, I have a heart problem, not that one, but thanks for watching. If you enjoy medical stuff and makeup, I mean, maybe not the makeup part because I'm not really that good at makeup. But if you enjoy medical stuff, for sure, watch again because that's exactly what I'm doing. Bye.